You can start, sir.
Okay. So, hello students. Today is my first class with Auricle. So, we are starting on the topic epidemiology. So, coming to an introduction to Auricle. So, here it is 21. It's a rapid series live class for university exams. Here it includes rapid revision of all important questions, volatile facts with quick revision, high yield topics of all subjects, and most expected topics, whichever you guys have in demand or which is most time repeated in the university exam. We'll be discussing those questions. Why is it beneficial? It is beneficial both for your next exam and for your university final exams. Okay. So I'm Dr. Preetham Shenoy from the Department of PSM, and you can use the below code for discount on subscription. So coming to today's topic, we have 5 main questions. That is, define epidemiology and explain its scope and importance in public health. Second question is, describe the epidemiological triad with suitable examples. Third is, explain the incidence and prevalence and their application in public health. Fourth question is, discuss the concept of natural history of the disease and its levels of various prevention. Last question for today is, explain the web of causation in relation to chronic diseases. So why choose Auricle? First one, it has recorded class sessions where anytime you can log in and access the recorded classes. You also have live classes where you will engage in real time with the professors and exam subject experts to clear all your doubts. Then we have exclusive practical sessions also where you will immerse yourself in the practical sessions until you have comprehensively understood the concepts and also the practical skills. We have the exam module where with a specially curated exam module, we cover entire subject under 20 hours. And last one, it is hard copy book set. Also, you can avail where you can elevate your academic journey with Auricle's comprehensive notes designed to lay a solid foundation. Now, what are the different modes of learning here? First one, we have a flexible learning, that is access foundational classes anytime, anywhere, and revisit the topics as needed to enhance understanding and retention. Second one is expert instruction. So learn from top faculty with in-depth knowledge of syllabus, ensuring you understand every topic clearly. You can enjoy the freedom to choose which one you want. Multiple educators' content you can access to. Then we have convenient revision also. So we can revise complex subjects at your own pace, eliminating the pressure of catching up and allowing for better mastery. So our teachers revise all essential topics for MBBS final exams, provide tips on answering questions effectively, and highlight the important points to include. So we prepare effectively for your first professional exams with Auricle's 45-day live class series. So it is designed to cover entire syllabus and all important past 10-year exam questions, and most important anticipated questions will be covered. We have in-depth coverage by experienced educators and interactive learning, along with MCQ polls, Viva votes, and many more. So we also have the examination module, which is meticulously designed to cover the entire syllabi in under 20 hours. It ensures efficient and effective preparation. So our expert educators place a strong emphasis on answering the writing skills, right? It is not good that you only know the answer. It is how you write the answer more skillfully, more legibly, I say. Yes. So it also helps you craft precise and high-scoring responses. With interactive sessions and a focus on exam strategies, you will be well prepared to excel in your exams. So we complete the syllabi in 20 hours with comprehensive and efficient coverage. Also, there is answer rating skills, that is mastering the art of high-scoring responses, be it diagrams or flowcharts or effective answer rating skills. Then expert educators, you will get the best access to. We also have doubt clearing sessions, right? So it is a student-centric approach. Every question, no matter how small or valued, and addressed by a dedicated educator. So never, you should never feel like your question is a stupid one. No, all questions are equally important. We all have to clear our doubts for concepts to be cleared. Also, there is personalized attention. So benefit from focused doubt clearing sessions designed to meet your individual learning needs and academic journey. There is also safe learning environment. So we can ask and resolve your queries without fear of judgment in a supportive and understanding setting. So we can ensure that you will prepare effectively for your first professional MBBS exams with Auricle's 45-day live class series. The program is designed to cover the entire syllabus with in-depth coverage, experienced educators, and interactive polling. Then we have question bank. So it has 3 levels of expertise concepture, beginner to expert level, customizable question bank for better exam readiness. It covers the MCQs for professional exams, NEET, PG, FMGA exam, and also the next exam, right? So practical sessions, as discussed, it gives you a hands-on experience with expert guidance, and you can excel in the practical examinations as well, especially your Viva OSA. Now we have 4 plans. The first one is foundation plan provided by the Auricle. It is for 3 months with pre-recorded classes, live classes, express exam module, practical sessions, and question bank. But you won't get a hard copy note set or one-to-one doubt clearing session here. It is for rupees 19,999. This second plan, which is at 32,999, it is for 6 months. Again, it has all the benefits of the foundation plan except the hard copy and one-to-one doubt clearing sessions. When you chose a third plan, that is complete learning plan, it is for 12 months or 1 year, which will have everything from pre-recorded classes, live classes, express exam module, practical sessions, question banks, hard copy note set, and one-to-one doubt clearing session, which is at 59,999, right? And the last one, ultimate MBBS plan, that is for a period of 4 years, you will again have access to all the benefits, and it is priced at 1,89,999. You can use the code Dr Preetham Shenoy 20 for a discount on subscription, only valid for today. Now coming to our topic for today, that is epidemiology part 1. As discussed, these are the questions of discussion for today's class, right? These are all short essays, so we expect it is to be around 5 marks, right? So your job is to write effectively the main points which are you will remember in that topic. Okay. So coming to epidemiology. So what is it? What is epidemiology? It is the study of occurrence and distribution of health-related events, states, and processes among whom? In specified populations, including the study of determinants influencing such processes, and applying this knowledge to control relevant health problems. Why is this definition wonderful? You don't have to by heart, just know these keywords. You will be remembering the entire definition. Why is it important? If you learn the definition of epidemiology, you can even write the aims, objectives, and the uses of epidemiology, right? So it is to study the occurrence, distribution of what health-related events, states, and processes among whom in the specified population. And also, not only we study the distribution and occurrence, we also see why it is causing. So the study of determinants influencing such processes. Also, it doesn't stop there. We go to apply this knowledge. Whatever knowledge we got through this, we apply it to prevent or to control relevant health problems so that in future we can use this knowledge, right? Coming to components, we have 3 components in epidemiology. The component number 1 is disease frequency. Okay. So what is disease frequency? It is nothing but numbers 1, 2, 3, 4, a count. That is the frequency. It is the basic measure of epidemiology. It is either a rate or a ratio. So these are essential for comparing the disease frequency in different populations, be it young age or old age, male or female, or any country specific. So different populations or subgroups of the same population in relation to suspected causal factors. So whichever causal factor, whichever cause is causing a disease, so we'll study that based on the rates. Okay. Such comparisons, what will it lead to? Important clues to disease etiology. We will know why the disease is occurring. Why? Because we will know in which group it is occurring, right? So it is also concerned with measurement of health-related events and states in the community and variables like blood pressure, serum cholesterol, height, weight, etc. The second component is distribution of the disease. First one was disease frequency. Second is distribution of disease. So disease, for that matter, health is not uniformly distributed in human population. Everybody is not equally healthy, right? There are fluctuations in each and every one of us. So how the distribution happens, in which pattern it happens in the community, and what will it lead to? It will lead to a generation of hypothesis. Now, coming to hypothesis, it is nothing but a statement. I tell you something, it is a hypothesis, right? Now, smoking causes lung cancer is a hypothesis. It might be true, it might be false. I don't know, which will have to be proven later, subsequently, by doing the research, right? So, epidemiology helps us to study these distribution patterns in the various subgroups of population by time, place, and person. This is very important. Time, place, and person. TPP. This is nothing but also called as descriptive epidemiology. Okay. Time, place, and person, wherever it comes, it is descriptive. I am describing the disease in terms of time. That is when it is happening, how it is happening, after how many days it is happening, place, where it is happening, right? And among whom it is happening, that is person, right? So that is how we describe a disease. Last component of epidemiology is the determinants of disease, or the causative factors, or the risk factors. So what are we doing here? We are testing the hypothesis. So the hypothesis which we generated here is being tested here by knowing the determinants, right? So this requires use of epidemiological principles and methods. What are they? They are the different study designs, be it cross-sectional study, case control, cohort, RCTs, etc. Right? So this is also known as analytical epidemiology. Okay. The previous one was descriptive epidemiology. Here we are talking about analytical epidemiology. The entire essence of our modern medicine, also called as evidence-based medicine, is dependent on these two things, descriptive and analytical epidemiology, right? So aims of epidemiology, it is according to International Epidemiological Association, first aim is to describe the distribution, right, and magnitude of health and disease problems in the human population. The second one is to identify the etiological risk factors. Third one is to provide the data essential to planning, implementation, and evaluation of services. Now, I told you in the start of the class the definition of epidemiology. If you by heart that, you will know the aims, right? All this to describe the distribution, to identify the etiological factors, and to provide the data essential for planning, implementation, and future, right? All these things are part of that definition. So that is a trick for you. If you remember the definition, you will remember the aims, right? A simplified version, the ultimate aim of epidemiology is to lead effective action where to eliminate or reduce the health problems or its consequences. That is either its severity or the total disease itself. And second one is to promote, right? I'm using the word promote. Why? Our branch of medicine also is not only curative, it is preventive, promotive, and curative services, right? So here we promote the health and well-being of the society as a whole. This is nothing but also called as health for all concept. Now, coming to the approach, how epidemiological approach is happening to health diseases and various problems. It is by on two foundation principles. Okay. The first one is asking questions, and second one is making comparisons. Now, I'm not asking silly questions here. What questions I will be asking? It is related to first one, health events. What are they? All of you should by heart with me these 6 questions. What, when, why, where, who, how. What, when, who, why, where, how. Okay. What is the event? what is its magnitude, where did it happen, when did it happen, who were affected, and why did it happen or how did it happen. So these are the questions we'll ask for each and every problem. Okay. So this is again a 2-marker for you. Tell me the questions in epidemiology. You will write all these 6 questions. Right. Second one is related to health action. First one was health events. Second one is related to health action. These questions are, what are these? What can be done to reduce this problem? How can it be prevented in the future? What action should be taken by the community, by the health services provider, by the other sectors, the private sector, etc.? Where and from whom these activities can be carried out? Next question is, what resources are required? That is, how much money is required to combat this disease? The program evaluation, right? And the difficulties which may arise and how it might be overcome in future, right? These are the questions. Second component, second foundational principle was making comparisons. First, I asked questions. Now I am comparing them, right? Where can I compare? It can be 2 or more groups. Always remember, it is not only 2 groups. Okay, it can be more than 2 groups. But there should be one group having the disease or who are exposed to a risk factor, and the other group is not having the disease. So one having, one not having, that is not exposed to the risk factor. Okay. So by making comparison, we try to find out the differences in the host and environmental factors between those affected and not affected. So before making comparisons, we ensure what is known as comparability, right? This is very important again, concept of comparability, or in other words, both the groups are to be similar. They will be similar. Okay. For facts to be comparable, they must be accurate and they must be gathered in a uniform way. I can't be doing different types of study in 2 different groups. It has to be similar. I have to do the same test in both the groups. Only then I can compare the results, right? If I do a fasting blood glucose in one group, I'll do a random blood glucose in the other group and tell that n number of people are diabetic in group 1 and n number of people are diabetic in group 2. Are the results comparable? No, right? I have to do either FBS in both the groups or a HbA1c in both the groups to confirm whether they are diabetic or not, right? So the study and control group should be similar regarding their age, gender, and similar other pertinent variables. Best method, how we ensure there is comparability, it is by randomization or random allocation. What is randomization? I can't predict where the person will end up. Okay. The person can be both in a control group or a experimental group, right? So that is how I ensure there is randomization. It is not in my hands. It is randomly allocated. And if it is not possible, if random allocation is not possible, like among whom? Among case control and cohort studies, then we do something called as matching, right? We'll discuss in detail when the study design is been discussed. Today, you just remember the words matching and randomization. So they have to be ensured there. Why? We might have confounders. Okay. I'll just tell you what is a confounder. A confounder is one which has relation both with the cause and effect, but in unequal proportions. Okay. I'll give you a simple example. As I told the earlier hypothesis, which is smoking causes lung cancer, right? So it is a hypothesis. Now I have done a study. I have cases of lung cancer and controls who are not having lung cancer. Then I will be asking history of smoking in both of these groups, right? Among cases, how many smoked, how many not smoked. Among controls, how many smoked and how many not smoked. Now, there is one more thing which people usually do when they smoke. What is that? Drink a cup of tea, right? Now, if I ask a second question in both the groups, did you drink tea? Most of them will say yes, right? Both in the case group and the control group. Now, that tea can't be told the tea is cause of cancer, lung cancer, right? I will be sounding delusional, right? So that is a classic example of a confounder. Here, tea, a cup of tea, history of drinking tea among cancer patients is a confounding variable. Okay. So we nullify such confounders by ensuring a study design is very organized. Okay. Coming to the uses of epidemiology. So this is how you will rate the first question. The last part should be uses of epidemiology. Okay. So to study the historical rise and fall of disease in the population. Always remember, history teaches us everything. How a pandemic happened in 1929, same to same it happened in the year 2020, almost 90 years later, right? So that is how, if we know how a disease occurred in the past, what were the trend of the disease, we can what you say, we'll measure the or quantify how severe it can be in the future. So always historical importance should be noted for each and every disease. Second question is community diagnosis. Now, this is very specific to our subject, community diagnosis. Like, we are not talking about the individual level here. We are talking about the community level here, how the population is affected, which age group is affected, which gender is more affected, right? So these are all community diagnosis. Next one is planning and evaluation. How we plan and evaluate for future, right? We plan a health program and we evaluate the services, health services. So we use epidemiology for that. Then evaluation of individual risk and chances. Now, each and every risk factor can be there both in the one group and the other. So how will we quantify it in terms of odds ratio or relative risk, right? So that is how we quantify the results and using statistical tools, and tell you how evaluation of individual risks and chances are to either get the disease or not have the risk factor. Next is syndrome identification. What is a syndrome? A collection of diseases, right? Classic example for a syndrome, yes, HIV, AIDS, right? So there again, there might be a group of symptoms which are common in one set of people, which is not common in the other set, right? So when we epidemiologically find out the reason for that, we can deduce there is a syndromic disease which is happening, right? So next is completing the natural history. I'll discuss about this in detail in today's class itself. Last one is searching for causes and risk factors. How different diseases are being caused and what are the risk factors which are leading for such and such disease. Now coming to the measurement of morbidity. So any departure, subjective or objective, from a state of physiological well-being is called as morbidity, right? Anything which is not normal for you, it is subjective again, right? It can either be subjective, it can be a objective. I can feel completely healthy, but when the doctor is seeing me and finding out there is some abnormality, again it is morbidity. Or else, second one, I might be fully okay in the tests and other results, but I might be feeling unhealthy, right? So that is subjective. So it is any departure from such. So three aspects of morbidity are morbidity rates, ratios, and frequency, duration, and severity. So coming to the first one here, it is incidence. What is it? It is number of new cases occurring in a defined population during a specified period of time. Given by the formula, number of new cases of specific diseases during a given time period divided by population at risk during that period into 1000. So for example here, if there had been 500 new cases of an illness in a population of 30,000 in a year, what is the incidence here? It will be 500, that is number of new cases 500 divided by 30,000, that is the total population in that area, into 1000. So it will be 16.7 per 1000 per year. Always remember, we have to tell this unit here. Many of you will forget to write this part. We will end up writing only this much. So always don't forget to write this per year. If it is 6 monthly, then per 6 months. If it is 10 years, per 10 years. Okay, that is how it is written. Now, what does incidence rate refers to? It refers to, again, only new cases, only new cases. I don't want the previous cases. When during a given period, time period, in specified population or population at risk. Also refers to new spells or episodes of diseases rising in a given period of time. Now, for example, measles will be coming and going, whereas cough or cold, it happens more than once in a year, right? Many of you will fall sick multiple times in a year. So there we'll talk about spells, number of spells, right? For that, the formula is number of spells of sickness starting in a defined period divided by mean number of persons exposed to the risk in that period itself into 1000. Here now, if I got cold twice in a year, now the incidence will be 2. It won't be 1. Okay. So coming to special incidence rate, first one is attack rate. Okay. So what is it? It is number of new cases of a specified disease during a specified time interval divided by total population at risk during the same interval into 100, not 1000, it is 100. Secondary attack rate, this is more popular one. Number of exposed developing the disease within the range of incubation period following exposure to a primary case. Primary case is the first case. Okay. Index case is the first case which is identified. Okay. So here we are talking about secondary attack rate. Why? Because it tells us, it signifies the communicability of that disease, how fast the disease is spreading, how rapidly the disease might spread, right? So it is at risk of having a community transmission based on secondary attack rate. Number of exposed people developing the disease within the range of incubation period divided by number of exposed or susceptible contacts into 100. Here, I have to remove the primary case, okay, from both the numerator and denominator. For example, if there are 4 children, first child got measles, okay. After 2 days, second and third child got measles, right? So what will be the secondary attack rate? It is 2 divided by 3. It is not 3 divided by 4. It is 2 divided by 3. Okay. We have to remove the person, the primary case, first child from both numerator and denominator. What are the uses of incidence rate? It is to control the disease and for research into etiology and pathogenesis, distribution of disease and efficacy of preventive and therapeutic measures. So if the incidence is increasing, it tells us the program is ineffective. Or rising incidence might also suggest there is a need for a new disease control or a preventive program, or reporting practices have to be improved. If there is a change or fluctuation in the incidence, it can also mean a change in etiology, right? So we saw during the COVID time how new cases started appearing in the second wave, right? So there was a change in the etiology because of the genetic nature of the viruses. They changed, the genetics changed. So because of mutations, so there was change in the agent, host, and environmental characteristics, right? So analysis of difference in incidence rates reported from various socioeconomic groups and geographical areas provides us useful insights into the effectiveness of health services. Coming to the second part, it is prevalence. What is prevalence? It is the disease prevalence refers specifically to all current cases. Very important, current, that is old and new. Old cases which are still existing, that is, they have not either died or recovered, and new incidence cases, okay, at any given point in time, over a period of time in a given population, right? So there are 2 types here. One is point prevalence, second is period prevalence. Coming to point prevalence, it is defined as number of current cases, old and new, of a disease at one point of time, either today, tomorrow, December 31st, January 1st, January 2nd. Each day, what is the point prevalence? So that is the prevalence. Okay. Number of all current cases of a specified disease at a given point of time divided by estimated population at the same point in time. Period prevalence is measures the frequency during a defined time period. Now, I'll tell you from Jan 1st, 2024 to tomorrow, December 31st, 2024, how many cases of TB? What is the prevalence of TB during this time period? So I have to include all cases who were there on Jan 1st and those who have not recovered on December 31st, right? And those who have already new cases which emerged in the middle of the year and they are still present at the end of the year, right? So all these cases have to be included. We can discuss it in more detail in this example. So case 1, it started before Jan 1st and it is there present after December 31st also. Case number 2 started before Jan 1st and ended up somewhere after Jan 1. Case 3 started in the middle of the year and extended up to after December, right? Case 4 started in the middle of the year and it either died or recovered in the middle of the year. Case 5 again, it extended like case 3. Case 6, it started after December 31st. Case 7 started previously and ended just like case 2. And last one, case 8, again like case 3 and case 5, started before 31st December, ended after 31st December. Now, what will be the incidence cases here? What will be the incident cases between Jan 1 and December 31st? They will be only cases which occurred after Jan 1st, right? What are they? Which are they? Case number 3, case number 4, case number 5, and case number 8, right? They all occurred in this time period, right? They didn't exist before Jan 1st, right? So they are incident cases. Coming to point prevalence on Jan 1st. On Jan 1st, what is the point prevalence? That is whichever cases occurred on Jan 1st and which cases were existing on Jan 1st, right? So it will be case number 1, case number 2, and case number 7. Point prevalence on December 31st will be again case number 1 because it is still existing. Will case number 2 be there? No, because it has ended, right? On December 31st, it doesn't appear. Case number 3, it is still existing, right? Case number 4, again, no. Case number 5, again, yes. Case number 7, no. Case number 6, no. And case number 8, again, yes, right? So what is the point prevalence on December 31st? It is case number 1, 3, 5, and 8. Coming to the period prevalence now, between Jan and December, it will be all cases except case number 6. Why? It occurred after December 31st. So it will be 1, 2, 3, 4, 5, 7, and 8. Now I hope you have understood the concept of incidence and prevalence, right? Now what is the relation between these two? It is I into D. Simple. Prevalence equals incidence into mean duration. Okay, so if the incidence is 10 cases per 1,000 population, mean duration is 5 years. What is the prevalence? 10 into 5 or 50 per 1,000 population. So this is an example diagram. A tap water which is continuously flowing, the water which is coming from the tap is the incidence. The water which is getting collected here is prevalent, the old water and the new water which is adding. And whatever the water is flowing outside from here, this outlet, by either recovery or death, that is minusing the prevalence, right? So this is the relation between incidence and prevalence. So what are the uses of prevalence? It helps us to estimate the magnitude of health and disease problem and identify potential high-risk populations. So it helps us for administrative and planning purposes also, especially hospital bed, manpower needs. We had a pandemic of COVID where there was scarcity of ICU beds, right? All those things can be understood better by knowing the prevalence rate of a disease. Coming to the next part, that is epidemiological triad. So all of you know the simple epidemiological triad. It is host, agent, and environment. There is triangle of epidemiology, which is environment, host, and agent with a time component in the middle. And there is one more, an advanced triangle or model of epidemiology, which is first one, it is causative factors, right? Second one is groups or populations and their characteristics. And the third one is environment, behavior, culture, physiological factors, and ecological elements. So the agent is cause of the disease. Host is organism, usually a human or an animal that harbors the disease. Environment is the surroundings and condition external to the human or animal that cause or allows the disease transmission to happen. And the time accounts for incubation period, life expectancy of the pathogen, duration of course of illness or condition. Okay. So agents can be either bacteria, virus, parasites, fungi, or molds. Non-infectious diseases, usually there will be other. It can be nutrition, it can be a tobacco, smoking, it can be radiation, chemicals, dietary food, etc. So coming to the web of causation, if I go back, give me an example of epidemiological triad considering malaria. Now, what is the agent here? Agent is, who is the agent? Plasmodium falciparum or Plasmodium vivax. That is the parasite which is causing malaria. Host is human being or the Anopheles mosquito, right? And the environment is rainy season, collection of water, not having adequate mosquito control measures. So these are all environmental factors, humidity, etc. Right? So that is an example for epidemiological triad. Now coming to web of causation, where it is important, it is important for non-communicable diseases, right? So it was suggested by McMahon. It is ideally suited in chronic disease conditions where disease agent is not known, right? We don't have a causative factor for hypertension. One causative factor is not present, right? It is an outcome of interaction of multiple factors. So web of causation considers all predisposing factors of any type and their complex interrelationship with each other. So it does not imply that disease can't be controlled, right? It doesn't imply that unless all multiple causes or chain of causation or at least majority are appropriately controlled or removed. Sometimes even a small removal of one or other linked factor, it is enough to control that disease, right? In a multifactorial event, therefore, individual factors by no means all equal weight, right? Each factor is not equally weighted. Some are more weighted, some are just a catalyst, right? The last one, it is relative importance of these factors may be expressed in terms of relative risk. So I'll tell you the example of myocardial infarction. If we consider this chronic disease or a non-communicable disease, myocardial infarction, what is the web of causation here? First one is changes in the lifestyle changes. What can it lead to? It can lead to abundance of food, right? Nutrition, excess calorie intake. There will be lack of physical exercise in such person. He or she might be a smoker. So what can excess calorie lead to? It can lead to obesity, leading to hyperlipidemia, leading to coronary atherosclerosis, right? Smoking, what will it lead to? It will lead to increased catecholamines and thrombotic tendency, thus contributing to coronary occlusion separately. Now, stress itself can lead to emotional disturbances. Again, this can lead to abundance of food, right? There is polyphagia in some people, right? So what can stress directly lead to? It can lead to hypertension, right? So again, there is change in the walls of arteries. Again, aging and other factors, that is also one more causative which will lead to changes in the walls and arteries. Again, there is age-related hypertension also, right? So obesity, again, it can directly lead to hypertension. So did you see this web? Once coronary occlusion happens, then the next cycle is myocardial ischemia and at the end infarction, right? So did you see this web? Each and every factor contributes to this final outcome of myocardial infarction, either individually or in association with other risk factors, right? This is how a web of causation is explained. Coming to the next concept of natural history of disease, it signifies the way in which a disease evolves over a period of time, from its earliest stage of pre-pathogenesis to pathogenesis to termination, either recovery, disability, or death in the absence of treatment or prevention. Okay, so how a disease naturally progresses in the historical concept. So each disease has its own unique natural history, which is not necessarily same in all individuals, which can be studied usually. Very best way of studying a natural history of disease is by cohort studies and MCQ question. So this is the slide from Parth. Here we have the disease process, right? we have levels of prevention and we have modes of intervention. So here, how is the disease process occurring according to the epidemiological triad? Either agent, host, and environmental factors. What is this stage called as pre-pathogenesis phase? Okay. The second one, the pathogenesis phase. Once this interaction happens, the agent, host, and environment have interacted with each other, what will it lead to? It will lead to the pathogenesis phase, right? So in the human host, what can happen? Interaction of host and stimulus, host reaction, early pathogenesis, discernible early lesions, advanced disease, or convalescence. There might be tissue and physiological changes. Stimulus or agent becomes established and increases by multiplication, right? So there is a clinical horizon. Till here, it can be an iceberg, right? We can't know. We don't know whether the person is having the disease or not. It is an incubation period, right? So once symptoms appear, that is clinical symptoms appear, then there is illness, disability, or defect, or a chronic state, a carrier state, and ultimately there can even be death occurring, right? Coming to levels of prevention, whatever prevention in the pre-pathogenesis phase is primary prevention. How we do it? By either health promotion or specific protection. Okay. Secondary prevention, what are that? It is only during the pathogenesis phase, secondary and tertiary. That means the disease has already occurred. Once it has occurred, we can do prevention of only secondary. Primary has failed, right? So how we do it? By either early diagnosis and treatment, then we start the treatment and limit the disability, and also we will do rehabilitation in some people. Pre-pathogenesis phase refers to period preliminary to the onset of disease, right? It has not entered, the agent has not entered the man. It is still in the environment and it is waiting for a favorable time for the interaction to happen, right? So what is required is an interaction of three factors to initiate the disease. So pathogenesis phase occurs with the entry of disease agent in the susceptible human host. The human should be susceptible, right? It multiplies, induces tissue and physiological changes, progresses through a period of incubation, and later through early and late pathogenesis. Final outcome may be recovery, disability, or death. So host reaction to infection will be not predictable, right? So infection can be clinical, it can be subclinical, it can be typical or atypical infection. The host may become a carrier also, right? You know the famous carrier, typhoid Mary, right? She was a chronic carrier of typhoid bacilli with or without having developed clinical disease. So she also didn't have any clinical symptoms, but she was going on spreading the disease to n number of people. So in chronic diseases, like in coronary heart disease, hypertension, early pathogenesis phase is preferred as pre-symptomatic phase. Okay. So we don't have the symptoms of chronic diseases yet. So it is also called as pre-symptomatic phase. So what are the agent factors? It can be biological agents like bacteria, viruses, fungi, etc. Nutrition agents, right, are dietary agents. Physical agents, chemical agents, they are both endogenous and exogenous. Endogenous, like body chemicals, whichever exist in our body. Exogenous, which we are exposed to, right, either occupationally or accidentally. Then we have mechanical agents like sun, sound, light, etc. Then absence or insufficiency or excess of a factor necessary to health. This is mainly for chromosomal diseases, genetic diseases, etc. Right? There is absence of something there. Last one is social agents, malnutrition, poverty, etc. Next, there is host factors. First one, it is demographic characteristics, age, sex, ethnicity, biological characteristics like genetic, biochemical levels of blood, various enzyme, immunological factors, and various functions of the organ systems. Then there is social and economic factors such as socio-economic status, education, occupation, stress, marital status, housing, lifestyle factors like personality traits, type A personality, type alpha males, some people are there, right? Living habits, nutrition, physical exercise, use of alcohol, drugs, smoking, behavioral patterns, etc. All these are host factors. So environmental factors, there are three. First one is physical environment, that is applied to non-living things and physical factors around us, like air, water, soil, housing, climate, geography, etc. Biological environment, the universe of living things which surrounds the man, including the man himself. So it can be viruses, other microbial agents, insects, rodents, animals, plants. They are all intermediate hosts, right? So next one is psychosocial environment. So those factors affecting the personal health, healthcare, and community of well-being of that stem from psychosocial makeup of individuals and structure and functions of social groups, right? So that is the psychosocial environment. Coming to the last part, that is concepts of prevention. First one is primordial prevention. I want to remember this. Primordial prevention is preventing the risk factors before they develop. Prevention of emergence or development of risk factors, right, in population groups is primordial prevention, right? For many example, if we prevent a teenager from smoking, if we prevent him before he starts to smoke the first cigarette, that is a primordial prevention. Okay. Second is primary prevention. It is defined as action taken prior to the onset of disease, which removes the possibility of that disease, right? So now a person has started smoking, right? But the person has not developed lung cancer. So I'm telling the person, please stop smoking. And that person stops smoking. Now what has happened? It is primary prevention, right? Example is low birth weight. Now, if I prevent child having being born a low birth weight by ensuring there is adequate nutrition to the pregnant mother or an adolescent woman or a reproductive age group woman, I am doing a primary prevention, right? So there are two strategies. There is population or mass strategy and there is high risk strategy. Population strategy is at whole population level, right? Whereas high risk strategy is at high risk groups. It is directed towards high risk groups. Coming to secondary prevention, it is actions which halts the progress of a disease at its incipient stage and prevents the further complications. How we do that? Either early diagnosis, screening tests, and ensuring adequate treatment. What does it do? It attempts to arrest the disease process, restore health by seeking out unrecognized disease, and treating it before irreversible pathological changes have taken place, and reverse the communicability of infectious diseases. Coming to last one, it is tertiary prevention. When the disease process has advanced before its early stages, beyond its early stages, it is still possible to accomplish prevention by what might be called as tertiary prevention, right? It is intervention in late pathogenesis phase. If it is in early pathogenesis, it is secondary. If it is late, it is tertiary. All measures available to reduce or limit impairments and disabilities, minimize offering caused by existing departures from good health, and promote the patient's adjustment to irremediable conditions is nothing but called as tertiary prevention. For example, treatment, even if undertaken late in natural history of disease, may prevent the sequelae and limit the disability from happening, right? So rehabilitation, what is rehabilitation? So modern rehabilitation, it includes psychosocial, vocational, and medical components. We'll discuss about it later in rehabilitation class. So I'll give you a gist. Primordial is before the underlying economic, social, environmental conditions leading to the causation, right? Even before the risk factors have started. So we establish and maintain conditions that minimize the hazards to health. What measures should be there? Inhibit the emergence of environmental, economic, social, and behavioral conditions. The target population is all the population or selected groups achieved through public health policy and health promotion. Primary prevention, special causal factors. Now, I prevent a person from smoking once he has started smoking, right? I tell him not to smoke and he stops, then there is decrease in the incidence of the lung cancer in that person, right? So how we are doing? We are doing a specific protection in that person. Secondary prevention in the early stage of disease. The disease has already occurred. Now, diabetes, chronic diseases, the person has come to you already, primary prevention will be failed. The disease has already occurred in that person. But I can prevent complications like diabetic retinopathy or diabetic nephropathy from happening. How? By giving adequate treatment, early diagnosis, active early treatment, and we can prevent the high blood sugars causing complications of diabetes or even hypertension, right? So that is how we do secondary prevention, right? Last one, tertiary prevention. Now, in the same diabetic person, if the complications, neuropathy, nephropathy, or retinopathy has already occurred, what we will do so that a person is rehabilitated properly, so that we can inhibit the disability or control the disability to maximum, right? Tertiary prevention in case of cancer is nothing but palliative treatment, okay? Palliative care. So thanks for watching. I suggest you to follow the social media handles of Auricle. These are the Auricle social media handles. You can also download the app of Auricle on Google Play and Apple Store. Thank you.